Bonjour, welcome for this DVD about the new manipulative approach of the spine and the pelvis. For the test, we must thank Dr. Gillet. Dr. Gillet was a chiropractor, a Belgian one. All the technique we will see after are original, coming from my practice. But Dr. Gillet showed us how to be so precise. I work with my two colleagues, Jean-Paul Mathieu and Pierre Mercier, to be precise. This guy was excellent, and he gave us the idea that it's not the bone that you are evaluating, it's the ligamentous system, the soft tissue system. We'll see some different techniques, evaluation of treatment with a costo-transversal joint. We have said that the disc is very connected with the head of the rib. You can see the radiate ligament is attached to the disc. There's a big problem in the dorsal spine when you have a disc herniation, because you have the spinal cord. A friend of mine is a surgeon, and he told me if you try to operate this disc herniation, you have 50% of chance to be paralyzed. So it's why they cannot operate on the lumbar spine. You have no more the spinal cord, you have just the root and the equina cauda. So it's why for us, when we manipulate the head of the rib, we are on the joint, but we are also on the disc, and we can have some effect on the viscoelasticity of the disc, and also the inside pressure of the disc. The treatment of the head of the rib. We put our thumb laterally from the spinous process at about 1 finger. Okay, we move a little bit the elbow in this direction, shoulder in direction of my thumb. I push the rib in direction of my thumb. You can see that my thumb becomes more deep than before. It's a triangle, and you must feel the tension going underneath your fingers. You treat first with these parameters, okay, follow the listing, do some indication. You can ask also to the patient to move the inferior limb, the lower limb. You do the same thing, you put your thumb, you move the shoulder, you move the rib in direction of your thumb. When you cannot go further, you ask the patient to move slowly the foot always on the table. Okay, you do it. And you have more extension, and you come, and you release. The point for us is to release the radiate ligament in order to have some effect also on the disc. As remember, it's very important for the disc. It's not painful, you must be gentle, move the shoulder, move the rib. When you have the tension, you follow the induction, and at the end, if you want to use some more tension, you ask the patient to move the foot and you have a little more extension. Depending on the pain, sometimes you can ask the patient to have the foot very close to this leg, and suppose you have somebody very supple, you can ask him to have the movement a little more posterior. But very often at the beginning, try to follow the foot along the other leg.